Hi, today we'll be talking about senile depression, which is more commonly referred to as late life depression. So it's a mental disorder that affects the elderly, women, elderly people 65 years and above, and it's not normal. Even though it's not normal, it's very common among this age group. So think about people that are 65 years, very elderly people, retirees, people that who are not working again, now our parents, our grandparents. So these are people that are hit with senile depression. So the key characteristics of senile depression, if you see an individual, you can actually know, or if it's happening to you already, you can actually know that, oh, I think I am, or he is, or she is having senile depression. So one of those key characteristics is mood and behavioral changes. So mood and behavioral changes, we have anger, frustration over small issues, like little things piss the individual off. So there's anger issue over small things, maybe a shift of items, maybe you just keep a cup here and somebody just move it 1 inches and they just flare up, they become angry. So those are one of the characteristics. Another key characteristics in terms of mood and behavioral changes is loss of interest to do things. So everybody wants to go out for a picnic and granny will say, no, I'm not coming out, I just want to stay on my own. So another characteristic is social withdrawal. So with loss of interest to do things, the tendency that there will be social withdrawal. They just want to be inside their room, they just want to be on their wall, on this island around themselves. So there will be lack of motivation. So of course, because there's lots of social activity, no motivation. So there will be lack of motivation to do things that every normal person is supposed to do. Maybe waking up, go for jogging, go for walk, go for picnic, go for holidays. They don't want to join. They just want to be on their own. So another physical symptoms that is clear is unexplained body pain all over. You just tell you that they're always in pain. So there will be weight loss, and the weight loss will be due to loss of appetite. So they are not eating very well. So loss of appetite will come in. So there will be mass loss of weight. And another physical symptoms is sleep disturbance. Of course, you see them, they will be struggling to sleep. And these are people that will go to bed and they'll just be lying there, opening their eyes, waiting for sleep to come, but sleep will not come. Their thought is full, constantly full with information. They cannot sleep, they cannot be at peace. So another physical symptom is slow movement or speech. They talk very little, they walk very little, they always want to be moving one place. So another symptoms is group of symptoms here is cognitive and emotional symptoms. So cognitive and emotional symptoms can be displayed with memory problems, dementia. They can start to lose memory of so many things. Even the newest information given to them, the latest information given to them, they will lose it. They will choose to remember what they want to remember. That is the memory loss here. So they will feel guilt. So feeling of guilt is one of the cognitive and emotional symptoms. So it's just like, what is wrong? Just feeling guilty that maybe something they have done in the past, not playing, but the brain is not playing it back to them. Maybe they fought in the past, or they beat somebody in the past, or they broke somebody's heart in the past. It will come in to play. So that feeling of guilt, this anxiety, fear of the unknown, panic, the suicidal thoughts will not come in. It will be like, maybe I should just die. Maybe it's the way God says I should come back to the earth. And be very careful. People that were depressed before, and you start seeing them being happy, or going to the barber shop, cutting their hair, like, you should mark something that this person is prepared to take his or her life. Be very careful, be very vigilant, be very watchful. So let's talk about the causes of this senile depression. So one of the causes of senile depression is changes in brain chemistry. Of course, with age, some people's brain chemistry changes negatively, and it could lead to senile depression. And that cause is comorbid medical illness. That comorbid means that there's a medical illness that triggers senile depression. So some example of this medical illness is Parkinson's disease, stroke, cancer, and heart diseases. They can cause this. They can trigger this senile depression. Family history of senile depression can also be the reason why somebody, the bloodline, the future generation, can also fall into senile depression. So if you observe that somebody is having these symptoms, please check the family history. Was the grandfather like this? Was the great grandfather like this? Ask questions so that you know that, oh, this is an ailment that's in the family. Another cause of senile depression is death of spouse or loved one. So maybe somebody, a couple that grew together up to the age, like let's say they are married for like 40 years, and one of them is gone permanently, is unalive. So it could lead to senile depression for the other partner, because it's very tough to move on with somebody that you have been together for like 40 years. Even breakup, divorce of over 40 years, 15 years, 10 years marriage can lead to senile depression. So we also say loss of function of body part. Maybe along as life goes on, in an accident, there's anything that leads to loss of body function, maybe amputation, maybe the removal of any tissue that is very significant, or just loss of body parts that is very functional, and the person cannot cope with that stress. So it could lead to senile depression. And also another cause of senile depression is financial concern. Yeah, some people can be bankrupt at a very old age. Maybe the investment they did blew up, or the bank came to claim property, or they couldn't succeed in life, or whatever can happen. So financial status could lead to senile depression. Lack of self-gratification. That self-gratification is you as an individual being satisfied that, looking at the past, look at everything, this is my fun, the dreams you have, your desire in life that you have when you were youthful, when you were young, has been fulfilled at least 80% of it, and you are justified that, these things have been done. If you don't have that gratification, then the individual may be hit with senile depression. The past history of depression, maybe history of depression in the past, somebody who is depressed, is more often, it's very common that in old age that depression will come back, and that depression will become senile depression. Another causes of this is post-traumatic disorders, so many things, past experience, lack of love life. These are things that can lead to senile depression. It doesn't have to do with you having things in life, having money. There are some things that you did in the past, your brain decide to rewire it and bring it out to you. So the treatment for senile depression is, if you notice it, go to a mental health facility. If somebody in your family and you're noticing it, take the person to a mental health facility. There are courses of treatment for the person, not just medication. So everything will be dealt with in a mental health facility. So let's keep depression out of the world. Let's stay happy, let's stay motivated, let's stay gigantic. Thank you for listening. I hope this will not be your portion. Bye-bye.